I say something?
Yeah, go ahead.
Just that as we speak, I have a grandchild that's being born. So I may have to get off and say congratulations for a few minutes.
So,
I'm going to get the news during the meeting, I think. Okay, thank you.
oh my gosh, that's great news. Wow. All right. Yay. Hello, everybody. We're ready to record now. So it's January 20th. It's Wednesday. And we're starting the meeting officially at 6:05 p.m. Betsy Beach is the secretary, so she'll be putting that into the minutes. And she just told me that she might have to leave suddenly in the middle of the meeting briefly because we have a backup person for her. We need to have a backup person for her. So if Betsy has to leave, is there somebody willing to jot down some notes so that we have a complete minutes? Bethany, are you able and willing?
I can try and make minutes from the transcript.
Okay, very good. So the plan at this point would be for Betsy to go ahead and be the minute taker. And if she has to leave, she'll let me know. And Bethany then during that period can fill in until Betsy's back with us at the meeting. All right, good. The minutes is a very important role. So we're going to do roll call now of who is here to make sure that we can document that we've met the quorum. We need 5 or more people. And also there are staff people here. So with the commissioners, I'm one of them, obviously. I'm the chair and I'm responsible for running this meeting. And as I look down, we have Betsy Beach. She's the secretary. And I also see Brett Hayes' name, Brett, who's one of the commissioners. The 4th commissioner is Bunmi Osho. She's here. The 5th commissioner is Carolyn Obrecht. There's a 6th commissioner who's a new person. Welcome to the first meeting, David Milani. And a 7th, also new, Drew Balsley. I'm trying to see if there's others. There's 7. Oh, there is an 8th. We have Tina Nelson. So there's 8 commissioners. We need 5. So obviously we've met the quorum. We're 3 above the quorum, so we can proceed with the official meeting. The staff from the Rhode Island Commission that are here, and if I miss anyone, please correct me. We have Bethany Link, who's responsible for hosting the Zoom meeting and facilitating. We have Ernest Covington III. He's the executive director of the Rhode Island Commission. We have 2 interpreters, but they're not staff. And we have Christine West. She's responsible for the Health Systems Transformation Project, HSTP. I'm trying to see if there's other people who are involved with the commission. Erin, I don't know if you're still on contract. No, Ernest is saying.
No.
Erin Pichardo, volunteering then. Okay, so Holly St. Pierre, she is responsible for interpreter referral. And we have the CART provider.
There's one more. Yep.
Lindsay Conway. She's on contract. Is that correct now, Lindsay?
I missed what Ernest said.
So I think that's everybody who's staff. Am I missing anybody? It looks like all the staff at the commission are here. And this is a public meeting, so I want to make sure that I'm acknowledging everyone. I tend to start the meeting asking for public comments before we get into our agenda. And I want everybody to be aware of the communication rules that we use. When you open your video window, we want a maximum amount of 4 because we're recording this and we want to have everybody be visible. It's easier on the eyes to see 4 people on the screen at one time if people need to access the recorded version. You can send a message in the chat. If you see at the bottom, there's a little, like a speech box that says chat, and you can click on that and tell me that you want to ask a question or send it to Bethany. Direct to me is fine. At the time that your comment's appropriate, I would recognize you and you could open your video window. We have a limited amount of time for public comment, but I would like to open at this point. And then if later during the meeting, you can always write me on the chat. And if we have time, I will recognize you. Obviously, we have open meetings and we want to be able to recognize all the public who want to speak, but we also want to get through our agenda items. I'm wondering if there's anything else. We have the interpreters and CART reporters. So if you need the captioning, you can see the CC live transcript box. You can click on that and you can either have it be subtitles. And I believe that if you have the subtitles, you can move them into a different area instead of the bottom. Yes, they end up being a box and you can take the mouse and move them wherever you prefer them, or you can see the full transcript on the side if you're not in full screen. I think that's it. So let me see if there's a chat comment right now. Let me just look. Bonnie Kaplan is here and is asking for a clarification. Bonnie, let me just see right now. You're in a thumbnail. Let me make sure that I can see you in gallery view. Perfect. I can see you. Bonnie's saying, Happy New Year, everybody. I want to clarify because first of all, I wanted to ask which policies you were following, whether it's Robert's Rules of Order or other. And at the last meeting, there was a question that I typed up to you and I felt like you completely ignored my question. Therefore, my question never got recorded publicly during the public portion. So I'm wondering how you're going to be running the meeting and what rules you follow, because prior meetings didn't seem to follow Robert's rules. And that didn't feel fair, especially when maybe other members of the community might have their questions also ignored and not be documented. So I'd appreciate if you could clarify that. Whether you have another system that you're using to run the meeting or you're using Robert's Rules of Order. Tim's saying very good. So if your question is about comments, the comment should be in the public, done in public, not in the chat. What the chat should be is to alert me to recognize you so that when you then open your video, you're interpreted and it's recorded by the CART reporter. And I just want to be clear. If you want to make a comment during the public comment section, sometimes what'll happen, somebody will write me and it's connected to an issue with Zoom, with technical aspects. And while the meeting is proceeding, it could be resolved. But if you actually want to make a comment, you should ask me to recognize you, call you next, and I would have you open your video. So that's the rule I have always followed. That's what I like to do as far as running the meeting. Let's see if there's, are there any other public comments at this time? If I hear none, I'll move forward with the agenda items that we have. The meeting minutes is the first item, which is from the December meeting. It was December 9th, 2020. Bethany, if you wouldn't mind screen sharing to show the minutes, give people a chance to read it. Oh, sorry, I just, sorry, if you could close the screen just so that I'm visible for a moment more. Yeah, sorry. The minutes were sent to all the commissioners and they should have had a chance to read it. But this way it's shown publicly. And if there's anything to edit or revise, and if not, or at the point where it has been revised, we can entertain a motion to accept the minutes as corrected. So we're not going to speak during the period while people are reading to give them a chance to have their eyes on the document. And then we'll turn off the screen share so that we can go back to this screen with with me visible. And if anybody has any questions. So right now, if we can screen share, and Bethany will scroll down the document so that everybody has a chance to read all of it. And as far as Bonnie's question, we do follow Robert's Rules of Order. I'm sorry I didn't say that, but that is what I use for voting. So yes, go ahead, Bethany. Thank you.
Tim, would you like me to close screen sharing now?
Yes, thank you. Very good. So we've finished reading the minutes. And I did notice one thing. Where the name is written, it should not only be the first name. For example, it said Shane. It should always say Shane Feldman. I would want to make that correction. Are there any other corrections or edits from the other commissioners?
Okay, does anybody want to make any revisions? Seeing none, then I would entertain a motion to accept the meeting minutes.
I move that we accept the meeting minutes with the addition of Shane Feldman's full name.
Does anyone second the motion?
I'll second the motion.
Okay. Seconded by Betsy Beach. So are we all in favor? If you are, please show your vote. You can do that either in the chat or you can raise your hand. Turn your video on. I see we have 3 here on video that are in favor of accepting. So we're going to need at least 1 more. Who else has voted? Tina abstains because she was not there. Boomy, okay. Now we have 5 in favor. And we have 2 new commissioners as well who've recently joined. So both of them will also abstain, is that correct? Yes. Yeah, we weren't officially elected yet in the meeting, so I don't know if we're supposed to vote on that or not. Is it allowed at this point? I think formally, yes, you haven't been recognized at this point, so you couldn't vote. So we have 5, so it passes at this time. We accept the meeting minutes with that revision that was mentioned with Shane Feldman's last name being added. Okay, so moving on from there, just a very brief chair report. First, I want to say Happy New Year to all of you. I know that today was a very historic day. We had the inauguration. We have a new president, President Biden, and Vice President Harris. So that's how we're starting out 2021. And at the same time, I want to ask, ask all of you to just take a moment to quietly just ponder the many ways that COVID has impacted people. Some of them have recovered, some of them have unfortunately passed away. And let's just take that moment of silence for all those impacted. Thank you so much for that. This year, 2021, we have a number of challenges, and hopefully we can see the light at the end of this tunnel. We can look at hope in our future And as a community, we can navigate our way through all these challenges. And we can end this year feeling very hopeful. So I'm excited to share with you that we have 2 new commissioners that have been appointed. Drew Baisley and David Maloney. Both of them have the same sign name, actually, but Drew has opted to have her name fingerspelled. So we extend a warm welcome to both of them as they're joining. And at the same time, we're looking for 2 more commissioners. So we're still on that search to fill some more seats. Okay. So now I'm going to go ahead and turn this over to Ernest Covington. He's the director, and he's going to share a report. So I'm going to turn that over to him. Hi, everyone. This is Ernest. So before I get started, I just want to say thank you so much to Tim for running this meeting for the last 4 years. And I know we have a new term coming up with a new president, and hopefully we're able to watch the inauguration. And I know today was a big day to the transfer of power. And so all of those that was involved with that. So new Vice President Harris, President Biden, we're looking forward to that future. So now I'm going to ask Bethany to please show the budget report in a shared screen. Okay. I know there's a lot of numbers, complicated numbers on that, but I'm going to go ahead and expound upon it. If you don't mind turning off the shared screen. Okay, so I just showed you the budget report, and we're really thrilled because the legislature finally passed a budget, and for FY21, we finally have that, it's passed. And so there's some good news. There's no 15% cut. Looking through that, there's nothing major that has a negative impact. Mostly it has remained the same, which is thrilling. And I know there's a lot of things that have come up, and we've had a lot of discussions about things that are emergency, potentially overspending and being careful. So looking at the current budget, we're satisfied with where we've at and how we've been spending. So we're going to continue on with 21. And now I know it's currently January, so we have a few more months up to May, June, where we'll continue to spend in the budget. And then we will begin FY22 in the middle of the summer. And we'll see at that point whether the budget will increase or decrease and the impact that COVID has had on that new budget. So hopefully we will maintain the same budget and that will continue. But they're still in discussions on that. And we're talking about another FTE for pulling in some for referral services. We've noticed that need because of some of the committees calling for interpreters, the scheduling, all of that falling on one person is just not feasible. And sometimes people are part-time. And so that's one of the reasons that we've requested, the requests have gone up. In the past, we would get a few thousand. Now we're up to 5,000 or 6,000. And with COVID, the requests have even more increased. So we've noticed that we do need to have more staff. So we're in negotiations for that FTE. And hopefully we will gain an FTE and we'll let you know if that happens. If it does, that means that we would also have added to the budget, hopefully 100,000. And you might say, why would it be at 100,000? And that's because it would include salary plus health insurance, plus other benefits, retirement, and all that together would be about 100,000. So that means that that would increase, hopefully increase the budget overall. But none of that is confirmed at this point. So we're just looking forward to that. And if you're concerned particularly of those funds, people have lost jobs because of COVID and all those concerns. At this point, we're happy to say that there was nothing fully negative in the budget that was passed. And I don't want to forget to add, but I want to thank Governor for accepting the new job at the federal level. So we already have a lieutenant governor planning on taking that position. So we're excited to continue to work with the lieutenant governor and with the governor. But when all that will be happening, Governor Raimondo will be going through some nominations before being fully moving into that. So she has some hard work ahead of her and she's worked well with us. We want to thank her for that. So moving on to the next part of the agenda. I just want to let you all know that I recently was impacted with COVID in 2021. And I know where I got it from. It was in December of 2020, and I got it at a restaurant. I love football, I'm a big football fan, so I had gone to watch the game, wore a mask, remained distant, and there were two women that started fighting. It wasn't even at night, it was just in the afternoon. I guess there was some sort of a relationship issue, and these two women started fighting, and they came over to my table, that fight, while I was eating. So I was eating, and they were in that space. And one of the servers took their mask down to talk, so I don't know which one of them. And then I just went home. So it was just a very brief encounter. And then a little while later, early 2021, it was a Sunday, I started feeling not the greatest. Started kind of getting tired, fatigued. So I had asked, just realized that I wasn't able to even get up. I was fully just worn out for a couple of days. And then I did get tested and it was positive. So I ended up quarantining at home. So I did not have too many symptoms, but I did notice that my sugar levels all, I do have that as an issue. So my sugar levels got out of whack, but now I'm fully recovered, doing well. I am no longer in quarantine and I've tested negative. But it was a very interesting experience, seeing how it's impacted so many different people. Some it's very serious, some have no symptoms, and some are lucky to go through with some light symptoms. So I had that experience myself. And it doesn't mean that I'm immune. There's no evidence that someone who's had it is fully immune. So I just need to continue to be careful and keep social distancing. And I would encourage all the staff to continue to work at home. And if something were to happen again, then we would need someone to take up the responsibilities in the office as needed. We already had a plan. So I just wanted to let you all know that that did happen. So hopefully the staff and the interpreters in the community are all continuing to be very careful with the spread of COVID continuing. I know we're in a dangerous part of the pandemic, but it was a very interesting experience for me. So hopefully everyone's continuing to be careful And as vaccines become available, I would encourage you to safely move forward with the vaccines. And we're not going to go into too much of that tonight, but yeah, it was a very interesting experience for myself. And the staff are still working remote. And that'll be until the staff feel comfortable coming back to the office. The governor has said that it's up to the staff. If they want to continue to work from home, they can. So it's important that we're able to finish the job and get things done. So if that happens at home, that might continue. And you can continue to contact the staff, video phones, emails, faxes, all those things. We'll continue to follow up and keep you informed with everything that's going on. When things come up, we are right on it, having meetings on Zoom. We're continuing to all work together virtually. So I just wanted to give you a COVID update on what's going on with that. So moving on from there. There's some staffing change, so I'll explain that. Lindsay will be transferring to a new position. And the staff, the HSTP staff, some of them have already transferred to other jobs. Lindsay Conway become a COVID interpreter. So there's 2 staff now.
And Thomas Darden is the other staff who left.
And we're going to be continuing to explain that. So if it hasn't been any more staff changes, but we did mention earlier the FTE potentially. So if that gets added, we'll see what happens at that point. That's an unknown at this point. So moving on from there. So now about COVID and vaccines. I'm continuing to work with Mike Baer with the Department of Health and the governor's office, and there's many other groups, and the plans for vaccines and the various phases and the phases, the parts of those phases, we're looking at each of the groups and establishing what the CDC has set out and trying to find out the best place for disability services and developing developmental disabilities and so many others, and trying to see them as in phase 1, which they were not. They were further down in the phases. So we did make a request about that with the vaccines being moved up, with people who have disabilities, people who have a high risk for COVID versus people who have no disabilities, some of them with multiple immune issues, health issues, communication issues, a number of different reasons. But it seemed that they were ignoring a large group of people. So we wrote a letter and sent that to the legislature, to the vaccine committee, and said that they needed to add people with disabilities and people who work in direct services. For example, interpreters, direct support services, and a number of other people. So we wanted them to be recognized as essential employees as well. So they did see this communication, and looking at the group of disabled people, there's been those who have no communication access, those who don't have that update. It seemed that they weren't responding and they were ignoring our message. Not seeing us on equal playing, those who are deafblind, those who really lack information and are behind. Those people who they should still be seen as and documented regardless of the fact that they're behind in this, and they should need this equal access for vaccines, and they should be free. So that's what it says. So we're encouraging them to follow their own protocol and provide equity in how vaccines are distributed. But so far, it's been a struggle to advocate for that. So Mike Bear has been working really hard in finding the right information, working through and communicating and talking about the vaccine plan. And that right now is where we are, working through that advocacy. A lot of people who are deaf and hard of hearing are contacting us. When are we up for vaccines? Interpreters are contacting us. They need it for safety on the job, for communication access. And at this point, I have no power to make a change myself. We are advocating with the vaccine committee and the Rhode Island Department of Health. I don't have authority to change anything myself. It's a role of advocacy. So it's requiring a lot of advocacy and asking them to do something. It's a tough situation right now. So Mike Bear is going to do some more explanation about the vaccine and the plan on that front to give you a better picture of what the plan is. So I'm going to let him go ahead and give a presentation at this time. Thank you so much, Ernest, and everyone. Oh, Ernest, just want to make sure that I'm on. Am I on? Okay. Hi, everyone. Just a couple of things to update you all on COVID. First, about vaccines. It has been a very big issue, and we're going to discuss that more later, but we'll come back to that. In phase 3, it's protect your household. That's the theme. And that's we're communicating to the community, the orders, the requirements. And now it's January 20th. So now the governor has extended these until February 19th. So everything basically is remaining the same in phase 3, which is in terms of social distancing, wearing masks, limited number of hours. All of those are extended until February 19th. So looking at those numbers, hospitalizations, statistics, they've been fluctuating. And Rhode Island is still above all the thresholds that the CDC has set. So the percent positive rate, the CDC is saying 5% or less. And Rhode Island so far since December and January is around the 7, 8 to 9%. And this week we finally come down to 5%. So we are seeing progress. However, we're still being watchful. So with the COVID numbers, I expect that the government regulations will continue for a few more months. That's what I would expect. Another point is when all of the vaccines started, they're all coming out from the governor of the CDC and then sent to Rhode Island starting in mid-December. Been looking at the vaccine news every day, and there's been a lot of changes and adjustments. So I felt that I couldn't communicate to the deaf community until things got settled and there was solid information. Ernest and I were watching that all of the communications coming out from the Department of Health about vaccines were all English-based. It was not in simplified English, and so they're asking us to provide translations of this information. So we decided to write a letter to Dr. Philip Chang, who is responsible for all of the vaccine projects. We sent that letter to him 2 weeks ago. He responded and he said, yes, we do need to do better by the deaf and hard of hearing community. So currently, just today, had a meeting with the Department of Health. It was a very good meeting this afternoon. Ernest and I were there. It was very basic. I'll give you an explanation, but so since COVID started last February until now, I've been able to provide ASL translation and give presentations and workshops through my office. Regarding the vaccine, looking through that, I realized that that information has to come from a medical personnel, a doctor, someone who is specialized in the medical field. I'm not a doctor. I don't specialize in medicine. So I'm not comfortable being the contact person for this information and making those translations. So the Department of Health, there's about 8 people that we met today. They agreed and said, okay, how can we work together with this? So I'm really excited to let you know that we have 3 plans. The first one is that we've asked Dr. Philip Chan himself to be able to meet with the deaf and hard of hearing community through Zoom, giving a presentation and allowing him to present and allowing the deaf and hard of hearing community to ask correct questions directly to him. He said it was very possible. And when he got that letter from us, he said I'm excited to learn more about this community, which was great response. So I think we're planning on that for the end of February, early March. I said the sooner the better for the community. We've been waiting a long time. So we're really thrilled about that and to have Dr. Chan give that. Also, the Department of Health is already developing some videos. So this week, Dr. Chan is just explaining some basic information about the vaccine in those videos, all the when, the who, the where, the why, all of those basic questions. And they're giving us those videos so that we can provide an ASL translation and then distribute it. So the second point is regarding printed material. We've asked them a printed material, basically website, flyers, all of them are English based. And they're not in plain English. So you may have recognized that I've done several myself where I've tested a few in the last month, just a very simplified English, getting an interpreter. And yesterday, actually it was this morning, we sent out some information on the vaccine plan. It's just as simple as possible. And I said I would need their help because I can't do it all. So they agreed to have someone who would work with us to write and choose some of the materials and simplify the English. But also, it wouldn't just be for us in deaf and hard of hearing community. It would be for those who maybe have English as a second language. And there would be a number of other people who in Rhode Island who English is not their first language. So it would benefit many more communities than ours. So you notice, are we switching interpreters?
So I wanted to talk also about our website. Some of it is a little outdated. Some of the information is current, but some is not. Last week, I went to a COVID intensive workshop. It was the first workshop offered by the Department of Health to healthcare providers, community advocates, and state agencies. There were over 300 people who appeared at this workshop, and I was so delighted to be part of it. It took an entire afternoon, and it talked about 5 areas: testing, vaccination, the demographics about the different cases and counting the cases, how to quarantine and isolate, because some of the rules have changed as per the CDC. And also the Department of Health has quarantine and isolation information, how to support people who are quarantining alone, let's say, who might be in a hotel or a motel and have to be out of their home because of family members at home who are at risk and they have to stay separate from them. So those were the 5 areas that were covered. So I'm going to update our website based on those 5. And also there were FAQs and other information that could help us. I'll be working on that. So that workshop last week helped me so much. And also the meeting today with the Department of Health, I feel more confident now that we will get DOH's support and help with getting this information out and communicating with the deaf community. I also, as I was speaking with them, I noticed with Dr. Chan that a lot of the conversation happens over Facebook, Twitter, and other social media from the Department of Health. The team realized that they needed to have interpreters available for those kind of communications, or if not, to give them to us and we could translate them into ASL and then distribute them. So they realized we need to do a better communication with the deaf and hard of hearing community. That was excellent. I'm very excited about it. Just looking at my notes to see what I've covered now. Actually, that is what I wanted to share with you. I've covered it and I am now open to questions. Tim or Ernest, and I'll hand over the floor. So Tim is saying Ernest has the executive director report and you were part of that. So then we'll open up for questions. And I do see that there's a person who has put in the chat that they want to ask a question, but I'm going to wait until after the report is finished. I'll let Ernest finish his report. Very good. Ernest is saying, very good. Thank you, Mike, for sharing that information. I really look forward to providing that and having everything work with the Department of Health. Yes. Oh, I just thought of one other thing. If I could share this. I'm sorry, I looked at my notes and then I realized that I hadn't said this. Related to vaccinations, there is no easy answer. It really comes down to the supply and demand. Because we have phase 1 and 2, we have 450,000 people who need to get vaccinated currently. But the federal government is sending us a very limited supply every week. Rhode Island only got 27,000 doses of vaccine. 28,000. And we have 450,000 people in Rhode Island who need to be vaccinated. So that is not a good ratio. And the Department of Health did explain, especially under President Trump, that the doses that were given by the state were based on population. And Rhode Island is saying, no, it should not be based on population. It should be based on need. For example, Rhode Island might have people, because we have a high COVID rate, we should get more doses than other states, even though they might have a greater population. That's a main issue and has been under the Trump administration. Many of us who are healthy and we're not in a high risk group, so we're not going to be phase 1 or 2. We're not frontline workers. We don't have underlying conditions. So we won't get vaccinated until maybe late spring, summer, or even fall, possibly, unless the manufacturers for Pfizer and Moderna can speed up their production 2, 3, 4 times more than they are now so that we can get the supply out to the states and those people can be vaccinated. So I wanted to bring that up. And Ernest had explained about disabled populations being marginalized and not feeling like they're included in they're not really listed as the vaccine subcommittee has 40 people, but there's no people with disabilities there. And so it feels like the government hasn't recognized us in Rhode Island. A lot of people are very upset. The Rhode Island Commission for the Deaf has joined in with other organizations, 15 different co-signers that have sent letters including the sign language interpreters, that we should be, the sign language interpreters should be prioritized, maybe in phase 1 or 2. But when you talk about people with disabilities, you're talking developmental disabilities, you're talking about people who live in group homes and congregate living. Usually those people might have underlying medical conditions, and their staff who are working in a group home with their consumers or clients. And that was not part of the original phase 1 list. My understanding is it's been revised, and developmentally delayed people in group homes will start to be given vaccinations. So that relates to the workshop I was at last week. I talked about being deaf, but I'm in good health, but there are other people with other disabilities who are at high risk for contracting coronavirus, and they should be, it could be underlying conditions, it could be their age, it could be other things that makes a comorbidity. And we should not be excluded from the decision-making process. We should be able to give the feedback. I did mention that at the workshop, and that helped when I sent a letter so that was addressed today during the meeting. And Ernest was involved. There were other people involved from the commission, and I feel like that got their ear. So they're going to give us more support about interpreting, about simplifying the English of their printed materials, and hopefully things will go forward better in the future. The vaccination situation is so complicated, and it really is a personal decision. The government can encourage people to take it, but you need to make up your own minds whether or not you want to receive the vaccination. And they're saying that the herd immunity needs to have 80% of people to be vaccinated to achieve that level where we can actually reduce the virus to the point where more people are immune, whether or not they've been vaccinated. And the recent administration, the federal administration, had a different view on coronavirus. There was a lot of controversy in the news. You had groups that believed in the vaccine, and other people who felt like coronavirus was still fake. And now with the new administration, with Biden taking office today, I'm hoping the situation will improve. I'm sorry to go on. I just think it's so important that people understand what the issues are, the issues behind the issues. Back to you, Ernest. Sorry. Yes, I wanted to thank you. There are so many issues on the agenda. And so if we could be more succinct with the reports, not eliminate them completely, but just try to be a little more succinct. I get your point, Tim. Mike is saying, thank you very much. Okay, thank you, Mike. I appreciate the report, and it's very, very good to hear that. Hold on a second. I've lost
The HSTP, we have the director.
no, sorry, I can't see him right now. Sorry. Thank you. I missed what you were saying because
We have someone to give a report on the HSTP now. We have Christine West. We're going to call her up. And she's going to explain more about the HSTP and the future planning that they're going to do. So Christine West is here. She's the project director. So I'd like to hand it over to Christine West to give a report on that project. Go ahead, Christine.
Thank you, Ernest. And Happy New Year, everyone. And congratulations, Betsy, on your new bundle of joy. I'll be very brief with my report. The no-cost extension on behalf of HSTP has been submitted to the Executive Office of Health and Human Services, and they have officially approved it. So the project will continue. In looking at the remaining years of the grant, we have until 2023. So the extension will continue until the end, December 2023. In looking at our budget and in looking at our project deliverables that we have left for the grant, we realized that a lot of the work has already been done in the previous year in 2020. So in terms of remaining work and remaining staff, we realized that we didn't need full personnel to continue into 2021. So we reduced our staff by half. I just want to thank Lindsay and Thomas for all their hard work and dedication to the project. And I'm thrilled that they've been able to secure other employment and are able to continue working within the community. So both Alex Laferriere and I will be continuing through 2021, and we will be focusing on the project deliverable of the consolidated report. As you remember, goal 1 includes the dissemination of 2 surveys, one for the deaf and hard of hearing community, one for healthcare professionals. Both of those surveys closed on December 18th. We do have the data for both of the surveys. I received the results from Gallaudet University, so I do have them on hand. I will also be meeting with them on Friday to talk a little bit more about the results.
It just froze.
Can you see me?
I can see you, but you froze for a second. Sorry.
Okay, okay. I'll go ahead and continue. Okay, so we have the results of the healthcare worker survey as well. So both Alex and I will be diving into the data. We will be converting that to visual format and we'll begin building our consolidated report for the community. So we're looking forward to working on that over the next year. In addition, for goal number 2, trainings for healthcare workers, we have been working with various content experts within the community to provide virtual trainings to healthcare professionals and students within colleges and universities in healthcare professions. So we'll be devoting our time to developing those trainings and disseminating those to the medical community as well. Just to give you some numbers for the deaf and hard of hearing survey, total number of participants for part A was 130 individuals, and for part B, 101 individuals. For the healthcare worker survey, total responses were 1,559. So we're really thrilled with the response rate. And again, we look forward to sharing that information. I also heard from the state technology folks, and our HSTP website, from what I'm told, will be finished at the end of this week. So if they deliver as promised, then we should be able to announce and unveil that website within the next week. We've also been partnering with Rick on another proposal to the Department of Labor and Training in their Real Jobs Rhode Island program. And so we're in the process of meeting with them and developing that proposal. If that were to go through, the grant would focus on health literacy, and it would build off of the work that our current grant has been doing. And we're looking at building capacity, increasing access, and accountability. And what we're proposing is for building capacity, providing training for community health workers. Those who are incumbent to develop more awareness about working with deaf and hard of hearing individuals, but more importantly, the creation of a workforce of deaf community health workers to serve as linguistic and cultural brokers between the community and healthcare providers. We're also looking at increasing access by providing increased information in ASL. So website information from various hospitals to provide ASL vlogs to make that accessible, and just better navigation and access to health information via print or electronically on the web. And finally, for accountability, the proposal of a position of an ombudsperson to serve specifically the deaf community throughout the state and serve as a navigator and an advocate for deaf and hard of hearing individuals throughout their healthcare journey. So this is what we're proposing, and we'll keep you posted on how we fare with that. And Other than that, most of our work will be on the interpreting program at Rhode Island College. And if anyone has any questions about that, please feel free to reach out to me or to Marie Lynch. You can also attend our healthcare committee meetings, which take place every month or every 6 weeks now, to get some updates about what that looks like. We are anticipating a launch of that program in June of 2021. So if all goes well, we look forward to that happening. That concludes my report. Back to you, Ernest.
Thank you, Christine, for sharing your HSTP report. I'm thrilled, looking forward to the future and hoping that all those things occur the way that we're hoping. That's great. That's a very big vision. And I'm really glad for your hard work, for making that work and by building all of these bridges with all Rhode Island College and labor and training, and hoping that HSTP can grow and expand. So thank you so much for your work. I'm pretty much wrapped up with my report, but I'm open for questions. And I did see that a person asked to clarify part of the report, but Amy, if you could appear first, if you could open your video. Oh, she withdrew her question, I think. She wrote me privately.
We were able to work out the clarification privately in the chat, so she withdrew it.
Very good. So are there any other questions? Otherwise, I can give the floor back to Tim to run the rest of the meeting. And Tim is saying, if there are any other commissioners who have any questions, if not, we have a brief committee reports. Are there any questions about the executive director report? If so, you can open your screen. Going once, going twice. All right. So with the committee reports, the first one is education. And I'm involved with that, but I'm not the chair of that committee. The chair is Nancy McGuire. Heath. And so I think they had a meeting. I think there was a meeting last Thursday, if I'm correct. I'm trying to remember what the date was for last Thursday. I can't remember, but last Thursday. And we were able to invite Sharon Applegate, who's at Deaf Incorporated in Massachusetts. It's based, she's the executive director of Deaf Incorporated. We invited her because we wanted to have her speak about her experience running Deaf Inc. and how the organization even started, to give us a sense on the committee of what would be required to run an organization like that and to possibly establish something similar to that here in Rhode Island. There's more discussion that needs to happen. So we need to work on what the needs of the deaf and hard of hearing community are in Rhode Island, how to make sure that people get together to start working on this. And we also have to think about the different roles people would have, like educating, advocating, and lobbying with the legislature to get money from the state to maybe provide the kinds of services that Deaf Inc. does, advocacy, independent living services, those kind of things. And also, the community needs to be involved to a great extent to make sure that that organization gets off the ground. So there's a lot of different aspects, and we wanted to have more meetings to talk about that after we had heard from Sharon. So that gives a summary of what that meeting was. Let me look. The next one is the employment committee. And I don't know if, oh, Ernest, if you could speak, and Betsy, you're there too. I'll let Betsy speak then.
Yeah, we met
Go ahead.
on December 10th. And we previewed a PowerPoint. It was on how to interview and how to follow up on interviews. And we thought it actually could be developed into a series of webinars. So we talked about how to maybe proceed with that. And then we've invited Liz Hubbard from the Disability Law Center to present on reasonable accommodations that may be needed in the workplace. And she's going to present at the next employment committee meeting, which I believe is going to be a week from tomorrow. So it will be the end of this month. And we've also sent out a questionnaire about what topics people would like to see presented in webinars in the future. And I think we've gotten some response. I think Ernest knows what kind of response we've gotten. But that was it. And we're prepared to meet again soon.
Thank you so much, Betsy, for your report. The next report we have is the Healthcare Committee. And it seems that that is related with HSTP. Brett, you have that report?
Hey everyone, how are you? The committee met last week, and we actually had 2 representatives from the Executive Office of Health and Human Services, and they came in and joined the meeting and talked about their project ecosystem that they have in terms of how they work with live data in the healthcare system. And it was a really good experience to understand how the state applies all health data from Medicare and Medicaid, and how they try to leverage that for their research and for reporting in terms of state needs and where their aid needs to go to. And I think a big question from the committee was asking about whether this office and their ecosystem, whether they leverage data on deaf and hard of hearing patients and how they possibly document interpreters and accommodation. The only thing we do know is that it's either Medicare or Medicaid. That's when they report their deaf or hard of hearing individual. That's the only way they can identify that there are deaf and hard of hearing patients in the data in the ecosystem. And rest assured, there's no personal information being divulged. It's all based on a unique identifier number. So sensitive information is not being shared. So I think that was the question most of us had, was about how we can leverage the ecosystem and get more information, and ask in the future if they can ask more questions about accommodation requests and interpreted as well. I know we also talked about the issue with the state in terms of their messaging to the deaf and hard of hearing community on the vaccination program, and how there's no real definition that the deaf and hard of hearing community fit in on the different phases for the vaccination in the state of Rhode Island. And I think recently Carmen Boucher, who's on the committee, she reported that they didn't specifically identify where our community would fall into. And as Mike Bear and Ernest have referenced, this is a hot topic right now, and we're trying to push through it and be advocate for our community. With that, we also talked about updates on the HSTP projects, and as Christine reiterated, they've done tremendous amount of work, and they accomplished so much in the last calendar year, and they're kind of using the remaining time and resources they have now on the interpreter training program at REC, and also working through virtual learning and resources that we can apply through our website and for the deaf and hard of hearing community. And definitely want to thank the HSTP project team for their hard work, especially Christine's leadership. And I know a few people have rolled off the project into other opportunities, but their work speaks for themselves. So with that, we'll probably have our meeting cadences a little bit less in between, maybe every other month, but we'll definitely keep in touch. Thank you.
Thank you, Brett. A great report. Thank you. The next on the list, know that we need to establish a tech access communication service committee. So I think Ernest had mentioned, or that hasn't been set up yet, but I wonder if it's going to happen this year that we're going to start that committee. I'm not sure on the budget where that would play out, but that's a question on that committee. But I know we do want to establish the committee. Yes, I'm planning on being in touch with Pam about that, and the committee name, how we're going to name it, and when it'll be established, but it is in process, and I am in contact with Pam about it. We are working through some of the information about when it would get started, and we will establish it. Thank you. We have one more committee, the Ad Hoc Interpreter Referral Service Committee. And this past December, it was approved. We had holiday, there was lots of stuff that came up with the holidays, but we were able to get some more names of people. So hopefully at the next meeting in February, we will have a full list and we can go ahead and approve 7 members to join, so we can start on that work. So right now, we also have Rhode Island Association. We have a name of a person. One name. And then I think we have Tina Nelson, who's interested in joining as well, I believe. And then we're in touch with a few more deaf people, I know, and some hard of hearing to be involved. So we're in the process and we're working on that in the near future. So I think that wraps up all the committee reports. But before we move on to any other unfinished business, just checking with the interpreters and CART, do we need a break for any of the 3 of you, or should we continue? CART? How is the CART provider? Do you need a break? Okay.
I'm fine.
Yeah, she's fine.
Okay, great. Okay, continuing on. So Bethany said that actually the educational committee met on January 14th. She sent me a message that was the date I was looking for previously. So now unfinished business. I know we need to discuss community collaboration, education, really raising more awareness during 2021, including Legislative Week. And typically every year, we have a Hearing Loss Awareness Month in May, and we have Deaf Awareness Month in September, and we have the coffee hour around November, about early November. And Ernest wanted to talk about possibly establishing a legislative week. So I'm going to turn that over to him to explain what you're picturing and what the commissioners could ask some questions about what that might look like. Thank you so much, Tim, for that. As Tim explained, we're talking about different ways to collaborate with the community. And we were talking about establishing a legislative week. As you know, last year we had a legislative day, but then of course it had to be canceled because of COVID, which was a real disappointment. So the legislative day, we wanted to have a lot of different organizations set up a number of tables, plus so people in the community could gather, and we could bring, do some short workshops, how people could advocate for themselves, how they could build relationships with their legislators, with their representatives, their senators, to be able to meet with the legislators. And the legislators would be able to see and be exposed to the deaf and hard of hearing community. What's that all about? What does the deaf world, the deaf and hard of hearing world look like? And it would open a bridge of communication between the community and the legislators. So then if there's any bills or anything that discusses the deaf community, it would be in the mind of the legislators what the community is and have those relationships. Of course, that went awry last year, the plans, because of COVID. So the staff had been talking about new plans. And we talked about it'd be even easier to do it on Zoom. We could reach a lot of people in the deaf and hard of hearing community and the legislative schedules. So we're planning on doing something, but we decided instead of a one day, we would do a week-long event. It might be an hour or 2 hours every day. And then at the end, we would all gather together for a meeting and maybe do some 1-hour workshops on advocacy and how to advocate for yourself in the system. So maybe a 1 hour on that. Maybe another one on how to contact your legislator, how to know who your legislator in the House of Representatives or senator is, and what's their role, and how do you reach out to them? How would you find something on the schedule? How do you address topics, address bills that are brought forward? A number of different workshops that would focus on development of bill, how that's done, how they're built, how they're processed. Because sometimes deaf and hard of hearing people in the community understand that they've written a bill and then it continues to fail, and they don't understand how in the process it failed. And so we want to discuss how a bill gets passed and go through and explain that information. So we planned to have a committee, 2 people. We want to explain the Senate and the representatives and have them come to that committee and then explain the communication, get some feedback that we're wanting their support, for any of the bills and information that comes forward, so that they would then be familiar with the deaf and hard of hearing community, because we've already established those conversations and relationships, and they would be more apt to support the community and by seeing how things would benefit us. I believe there was one other thing I wanted to add on that. I think that wraps up about the community. But we wanted to think about different stakeholders that would be involved in various bills and really be able to involve the community. And yes, of course, we want to have stakeholders involved, but we want to know specifically, what does the community want? We know what different stakeholders want, but we don't want to just move forward and not really consider what people in the community, BIPOC, all different members of the community would be interested in. So before we open up to a group discussion, we want to find out what the community, what they want to be developed for different bills that would benefit the deaf and hard of hearing community. What are their needs? Is it more medical needs? Is it more services in the workplace? Is it related to the deaf and hard of hearing employment? We really want to hear from the community and know what their needs are and let their voice come forward. Because I feel in the last bit, as we've been talking about this, their voice has been absent. So we want to give the floor to the community to take notes on what bills they want to see, and then we can start drafting them. And at the same time, request the community, okay, how do we get something passed in the legislature, and begin that conversation. And yes, we've proposed a bill, but then you know, if the legislator's not interested in the committee, they're interested in the people who are behind the committee. So if there's nobody behind the committee, they see the bill as not important. But if they see that there is a crowd of people behind the committee advocating for a bill to be passed, it's going to draw more attention and interest from the legislature. So we want to really, the legislature, they're interested in votes. If there's no voters, then there's no interest. So we really want to encourage the community that if we're developing a bill, they need to be there advocating with us. So for an example, last week, there was one really important project we've been working on. And we had amazing advocacy. There was a lot of proactive work going in, organizations, and the legislature realized, oh, we see there's a lot of people interested in this. But previously, the legislature didn't know anything about the deaf and hard of hearing community. We need to continue to expose and educate and allow them to, understand the deaf community and the needs that are there. Massachusetts has a very strong project for the deaf blind. And a lot of it is because of community activism. And the Deaf Blind Committee has gone into the legislature, gone into their offices, explained their needs, and shown that their different specialties. And the legislature has been amazed by the deafblind community. And then they say, okay, we see why we need to support you. And then their votes are there. But if they don't see anybody supporting, nothing gets done. So learning from that, we really want to continue to pull in the community for advocacy, because if the community isn't there as well, if it's only, and the Rhode Island Commission here will only grow as much as the community is fully in support, and that's growing as well. So we really need to pull back in the community advocacy and not work in isolation from the community. We want to build that collaboration, because that's where real change will happen. And as much as the legislator recognizes that the community is there. So we want to see how it's really important for the community to see that they can be empowered, they can be involved, and their voice can be a part of the discussion. It's great. We have great community advocates already, but we need more BIPOC. We need more of many different varieties throughout the state of Rhode Island. And it can be tough, but we really want to pull people in from all walks of life into this discussion. So I want to ask the board, the commissioners, if you see this as very valuable, then we want to go ahead and get started with this and begin reaching out to the legislature and representatives, the House and the Senate, and look at some schedules. I know they're very busy, so it'll be a task, but we want to pull some people together, make some appointments, set some workshops, and get started. So hopefully we're looking at something in March, potentially. That's the hopeful date. Plus also, I know Pam has been working on preparing some things in Zoom as well, doing some coffee hours, some the different months that we've done in the past is doing a week-long event like this. So we're really excited about it, but we want to hear feedback from the other commissioners here before we move ahead with it. So looking forward to your feedback. Tim is saying, so this, you're talking about this would happen this year in 2021. So I think there's only a week or two left to propose a bill. The legislative week, I think, is more for planning for presenting a bill in 2022. So within the commissioners, we want to figure out how to pull in more community members. And I think we did that with the movie captions. I know we were having a really hard time. So we ended up doing a big protest with the movie theater. It was on the news. And we brought 20 people. I think something similar to that idea. The more people we get involved, the more push and the more attention, then there is motivation to do something. to have open caption on movies. I know now, of course, with COVID, that's not something current right now that we're able to do, but to look at the success of that event and that issue that people were very concerned with and got behind and pulled in a lot more people to be involved with. I thought that was really great. So I just want to ask the question to the commissioners, is there any discussion questions or ideas? So we'll just open the floor at this point and you can pull up your video, and we're just going to switch the interpreters before we do that.
If there are any commissioners who want to make a comment or ask a question, Betsy?
Yeah, I think it would be good to like figure out what people might be interested in. And then if we present some topics, often people will come out, for some kind of community forum. I don't know. I just think the topics are also important. But I like all these ideas. I think it's exciting.
Good. Great, thank you. Was anyone else who would like to make a comment or ask a question specifically about the topic we were just talking about? Yes, Drew. Hi, I was thinking about what Betsy just said, and I think it would be an open forum, would be a good idea that, each person, what's going on, maybe people have overlooked certain things or they haven't advocated for certain bills because they don't know about them. People might not know how to hook up with us as commissioners. So I think during that week, if we could have an open forum beforehand so that we could understand, they could know what our roles are, they could help us do things, we could figure out on opportunities that we're missing, maybe they'd be involved in other committees. Then when we go there, we would know more about people's backgrounds. I think the forum would be good beforehand. Like Betsy was saying, related to the planning and getting that involvement early on. Yes. Thank you, Tim saying. Other comments or questions about the ideas for Legislators Week? All right, seeing none right now, I did want to say in the past, we've had community forums. We've actually had several over time. And I remember once there was a huge number of people who came because it was a hot topic. We were speaking about language assessment, the bill for children, for deaf and hard of hearing children, about evaluating their language, seeing if there was any delays. That was a huge turnout and it was controversial. So I think when we have a group, who had supported or didn't support that bill, later we had another community forum and there were only a few people who showed up. So I think we need to have something people are motivated to come in, some big issue, a hot issue that's important and significant for people, then they will be involved. So that's something that we might want to brainstorm on finding to, really bring people in. Yes? Yes, David. So the people who are involved, whether it's the Rhode Island Commission staff or the commissioners, they could make a vlog talking about, what does the commission do and what we can do ourselves versus what we can do with the community's input. And I think, people might not have had that much interaction with us because of Instagram and Facebook being a little quieter. We could have open-ended questions that bring us, people could talk about, oh, we want to do this or we want to do that. I feel like the community doesn't really know what to even be involved with or what we're actually doing. And they're looking for solutions. We want to draw them in. So I'm thinking something rather than just speaking about, oh, this is going to be at this date and time, they're going to feel very disengaged. But if we could get something that could really, draw them in and excite them. I'm just thinking something that we would actually, when we do the advertising, we would include that. Yes, Carolyn.
So one thing that strikes me is, Tim, you were talking about inviting the woman from Deaf Inc. and that we don't really have an agency like that in the state of Rhode Island, and we need state funding for that. That strikes me that that would be a big topic issue, because within a future Rhode Island Deaf Inc., you'd have independent living skills, you would have advocacy, you could potentially have a mental health provider, which is something I hear the need for every day. And we need state money. So I wonder about perhaps identifying that as a need and seeing if the community wants to support that.
Yes, I see Betsy.
Yes, I like, oops. I like Carolyn's idea, and I think the other hot topic is going to be vaccine distribution. I don't really know if it's part of a legislative issue, but I think a lot of people would show up for that topic. It's just a timely issue at the moment.
Yes, to have some kind of action related with the legislature, like a new bill or something that we're trying to pass into law. But we also have systemic advocacy about working with the state agencies and who they are, what they do, trying to lobby them or advocate to add some policies or resources, that kind of thing. Yes. Amy? I would like to just make one suggestion if I could. I was thinking of working with DCYF, the lack of policy updates, they, requiring deaf interpreters for ADA satisfaction, for complying with deaf children, and to have an initial meeting that we had with DCYF to investigate that. I think that's an important thing for the community, to build some trust, and also to see where the state has some changes in relation to working with the deaf community. I hope that helps. Thank you, Tim saying. And we have some kind of examples about system-wide advocacy, and also now we have 4. What I'm thinking about is, can we oppose certain bills that are discriminatory? That would be system-wide. And another thing I'm thinking about is the media, news, and the way we're portrayed and represented in the media, to try to raise the consciousness of all these different aspects that we're talking about. I noticed that the Rhode Island Commission very often talks about the legislature, but it might be good, if we have a new law, let's say, and it doesn't have teeth in it to enforce it, that could be an issue. So when the law passes, then we have to think, how can it be most effective, and how will it be applied so that it's the best service for the deaf community? Ernest, I'm wondering if you need us to approve the legislative week, or can we just go forward? Ernest is saying, well, first of all, these suggestions are fantastic. I'm all for that. And I really want to thank all the people who suggested. I like the topics. I think they're very interesting, and they would recruit people. I think that they would draw people. All of these suggestions we've heard so far. So I'm going to talk to Pam Zellner and to Bethany and just try to figure out how to use these ideas. And also Amy's point about DCYF and the policies being outdated. We need to have deaf and hard of hearing people actually complain about it and advocate for themselves. And I appreciate so much this input. This is great. As far as this work, as far as approving it, we have the approval for the actual event. So we'll start moving forward on planning, and we can ask the commissioners to vote on this topic. So yes, okay. So then I'd be willing to entertain a motion from one of the commissioners so that we can move forward on approving legislative week. As the chair, I always ask the other commissioners. I don't want to make the actual motion if I can avoid it. I'm not seeing anyone. Betsy.
I'll try. Okay, I'll make a motion to approve that Ernest go ahead and start making plans for a legislative week to be held probably in early spring.
Okay, right. Do we have a second? Tina seconds. Tina Nelson. So is there any discussion on this motion on the floor? Or more discussion, I would say. And if none, we can move forward with the vote. So is there, if people are in favor, if you would please open your videos to show your support for this motion. And we can get the count. All right, I see 1, 2, 3, 4. I'm 5. We've got 6. I think there's 2 other people who haven't voted yet. If there's anyone opposed. You're 17. So we have Bunmi on the call, I think. Do you have a vote? You're voting up. Great. Very good. So now all the 8 people who are here who are commissioners have voted in support, 8-0. That's great. So the motion passes. And I think, if I'm seeing B, we actually have discussed that some, if I'm looking at the agenda. It's related to the planning for legislative action or priorities in 2021, and to work with the in collaboration with other stakeholders. So I did want to make a comment about that. When we were talking about the vaccine, we coordinated with other groups to send a letter, and it seemed, well, I hope it's effective. It's good to have those partnerships. And my thinking about this for Rhode Island, the Rhode Island Commission is very small, and the community, we're challenged about outreach to the community. So an issue like this does actually provide, there's some similarity with what other groups are working on, and we can work together to be more effective in helping to pass certain bills. For example, there was, well, this is more related to coronavirus and how it impacts the community. Not related with the commission, but me personally. I wanted to be involved in a committee, and there were, I think, 500 people involved. And, you know, by working with Black, Indigenous people of color, unhoused individuals, all of these people, we came together and we were able to propose a law. And nobody had mentioned like people with disabilities. So tomorrow I actually plan to have a meeting with one of the people who's responsible for that. And it's not related, I'm not representing the commission on this. I would be there. This is just an example, I'm thinking as a deaf person, how we could be involved in different efforts that work with deaf and hard of hearing people, maybe to help educate people about the work they're doing and make sure that we're included. And we can monitor if a bill is introduced in the legislature, to monitor what the bill includes so that we could be involved in a committee or help edit the language of the bill to get in early enough to be able to give feedback so that we could help deaf and hard of hearing people in the state. We don't have to always be doing it on our own. We, you know, as they say, many hands make light work. We could work together with other members of the community. So I'm just, yes, Ernest. I wanted to add to the comment you just made. The staff have talked about this. The Rhode Island Commission for the Deaf can't be a standalone organization ongoing with, you know, all the issues coming up with COVID, vaccines and all this. I think it's very important to make allies with other organizations and other agencies, and to explain what our point of view is, what we're working on, what areas we're interested in, educate them. When they realize how it affects deaf people, when they, it's sort of like I scratch your back, you scratch mine. I think we can work together and build a great alliance that will help make a real difference for people and an impact. When we've exposed them, then they realize, oh, the Commission for the Deaf and Hard of Hearing is something that's doing X, Y, and Z rather than an unknown. And as you're talking about writing that letter, I see that as a huge impact. And Mike Baer was talking about working on vaccines and working with these other groups at the workshops and the meeting he had with the Department of Health. So now we're starting to get the ear of these policymakers. It used to be that they would throw it at us last minute after so many of the decisions had already been made. And very often interpreters weren't available at the times that they were saying. So now they're giving us a little bit more advanced notice about when the press conferences are happening, which allows the staff here to coordinate interpreters for an ongoing meeting and to facilitate making sure that interpreters are available. And that's because of partnership, because of education. And I've noticed that to build those kind of relationships, it'll make our job easier, but it'll also make their job easier. There'll be mutual benefit and also benefit for the deaf community at large. And I think when my vision is that by being an ally to these different groups, we can recruit allies for our work and we can make solutions together, which help us and the legislature as well. Because the legislators at this point are starting to recognize us somewhat, and we could work with them during legislative week to make sure that the bills, we would know, they would ask us if we support them or oppose them, and we could give our feedback. It would give us a strength in that relationship, which I think is essential for the commission to build on. I don't think we can be standalone successfully in the long run. So I really like your suggestion and I want to work with that. Tim is saying, in the interest of time, there's so much that we have to discuss about legislative week, and now we only have a few minutes left for the meeting. So if there are no further points being made about this, I'd like to move on to other items in the agenda. But I'm willing to get some last comments about the legislative week. Seeing none. I wanted to talk about C, unfinished business, talking with the senators and the state reps about issues that impact the deaf blind, deaf and hard of hearing, and late deafened. So we talked about legislative week, but moving further down the agenda for new business, I'm just looking. This point about advocacy, about deaf, mental health for people with disabilities, and the whole issue about COVID vaccinations, that has been discussed already. And Ernest, I just wanted to ask if that item needs any further approval from the commission, if there's anything we can do to push that forward. And Ernest is saying, no. I think that's fine because I'm working with Mike Baer. Mike is doing a great job. So thank you for your support, your ongoing support as the commission. And I think we're good there. So Tim is saying with the vaccination issue, I saw it was in the Washington Post that there's an issue now happening in the US, not just in Rhode Island, that there's a scarcity of vaccines. There's a big issue about supply. So I did put that in. And then going down the next item, if there's anything urgent that we need to discuss that are concerns related to COVID. And the word vulnerable, I hate the sign for it. I'm thinking the people who are most vulnerable, most high risk populations. For example, deaf blind people who might not be getting the right information, the Black, Indigenous people of color, BIPOC, immigrants, children, elderly, senior citizens. And if there are any people who feel like there's an urgent need to focus on a certain group, I would like to take that opportunity now to talk about that if people have something that they want to bring up. But if you feel like Mike Bear's report and the work that we're already proposing for the Rhode Island Commission has already addressed those issues. Yes? We're switching interpreters. Very good.
So looking, I'm not seeing anyone who's requesting to comment from the public. Is there any commissioner that wants to recognize any concerns on this topic? Or anyone from the community? Seeing none, going once, twice. All right, we'll move on further along in the agenda. The next item we have is Shane Feldman has informed us last year we first started working together and we established a board retreat. And the original plan at that point was to establish goals together, to really dive into our organization, try to do some analytics and do some future planning, clarifying roles and whatnot. The commissioner roles and the roles of the executive director and staff members. And there were different parts of that we were going to work together as a team. Of course, last year, due to COVID, the board retreat had to be canceled. So some of the commissioners, with COVID going on and their employment, working remotely, there were a number of different things and adjustments we had to make. And so now we're kind of coming back and having more people on the team. So Shane made an amendment and he wanted to continue to gather and identify data so that we could look at some metrics. So he started looking for data and was having a really hard time with that information. It didn't seem that we had a lot of data with deaf and hard of hearing. He was starting to contact other states and finding that Rhode Island is actually a little bit ahead of some of the other states in regards to some of the health projects like the HSTP, more ahead than some of the other states that they contacted. So Shane felt that we have to make an amendment and come back to our original contract that we were talking about and establishing a board retreat. And we want to bring that again. I know right now I feel like this is a lot of amendments, and also with COVID, there's still a lot of challenges with this. But if everyone here would be in support, it would be myself, the vice chair, and there would be 3 of us, and Shane, as we were talking about, would do some meeting and then bring it back to everyone, make an amendment back to our original terms of that agreement. So hopefully you would be in support. I think, Ernest, did you want to add something to this? Yes, thank you, Tim, for that. I just wanted to let you know that the agreement, we're still honoring that agreement. We're still paying, and we felt that that contract is not finished. So there's nothing that would be impacted regarding payment or funds to Shane. We want we're not ending that contract. Just letting you know, just want to add that. Caroline,
That's me.
do you want to add to that?
Yes, I think that the idea of a reimagined retreat is a good idea. I think that with our new commissioners and some new initiatives, it would help us to work together better, get to know each other better, team building. So I think that that would be an excellent use of time and resources. And obviously, we'd have to be creative, so it would be Zoom, or I guess Zoom. But that's what we've got.
Thank you, Caroline. So how does everybody else feel? Is that something that we want to make a motion to approve going back to the original agreement with Shane Feldman? To the Envision strategies, that would be really nice. I think some of you might be camera shy. Tina just said it's a great idea. And I need someone to make a motion. Boonmi? You're muted. We can't hear you. If you can unmute.
Sorry, yeah, I make a motion to move on with the idea.
Okay, so your motion would be to go back to the original terms of the agreement with Shane Feldman.
Yes, since
and-
Ernest said it's a goal that we're not going back on it.
Okay. So I need to have somebody second the motion.
A second.
Okay, Caroline, you're seconding the motion. So everyone who's in favor, just turn on your video or put it in the chat. Three, four, six. Boonmi. Well, she made the motion, so I'm assuming. Did you vote as well? Because we're at 7 without you, Boonmi. No? Boonmi? Are you going to vote as well? Okay. I see the thumbs up there. All right, so we have a total of 8. So the motion passes. Thank you, everyone. So I think we finished with that. Now, moving on, we just have a few more minutes. So we're going to try to wrap up here. So there's 2 things connected here. We have 2 more Rhode Island Commission seats available. So we're thinking of doing some more vlog promotion again. Some of you might think of some people who you may want to reach out to, some people who are different, maybe not the traditional, maybe you would try a different way, not the traditional vlog, but other ways of doing outreach so that we can have more applications for those 2 seats that are available. I know we don't have a lot of time left, but I'm happy to make a vlog, or maybe if we have something, another idea for doing outreach. So I'm going to ask some of the commissioners to be a little bit more creative and proactive in reaching out to the community. Does anybody want to add or make a comment on that? David? So are those seats for people who are deaf and hard of hearing, or what are those seats designated for? One, it would be for deaf people who sign. Okay, I have some, can make some personal contacts to a few people and reach out. Good. I think it's important to try to think outside of the box when we're reaching out to people and really get a diverse group. We want to have a lot of different people represented here on the commission. So we want to include Black, Indigenous, people of color, and a number of other people. So we have some new commissioners join. So we also have a website update. We have some old pictures on there. So we need to update that. So we're going to ask, maybe Ernest can identify some staff who can coordinate gathering our pictures so we can update them and update some bios on the website. And we do need to remove the group picture. Of course, now with COVID, we can't do another group picture, but we could add individual pictures. Ernest? Yes, we've already reached out to some of the commissioners to get some updated bios and pictures. And we planned to reach out again to some of the new commissioners, David and Drew, to get pictures and bios from them as well. And we're in discussion of a group picture, but of course, instead of that, we were thinking potentially we could do as a Zoom picture, as we could take a screenshot. It might save time. We could do it at the next meeting when we have all of the commissioners present. Of course, now with COVID, we just have to accept maybe a group Zoom picture. But we can be in contact about that situation and continue working on updating that. Thanks for the reminder, Tim. Thank you. Okay, so we're at the end of our meeting, but I have a quick announcement. First, I want to say congratulations. Our neighbors in Massachusetts, the Commission for the Deaf and Hard of Hearing just hired a new commissioner, executive director, named Dr. Opowa.
So Turnwa.
Shopchunwa. And I believe OPE is how they're abbreviating their first name. Shopchunwa. I believe they've previously worked in Missouri at the Commission for the Deaf and Hard of Hearing. And now they've been hired to work in Massachusetts. So now we have a new commissioner there. So congratulations to them. Are there any more announcements? Betsy Beach, do you have a special announcement to make?
Oh, you're muted still.
Muted. You're muted, Betsy. Could you unmute?
My new granddaughter was born during this meeting. She's in chat if you click on the image. Healthy, 7 pounds, 14 ounces. So I'm excited.
Congratulations. Is there anybody else who wants to make an announcement or comment? Oh, I see the picture was just posted in the chat. Great. If there's no more announcements, then I want to say thank you to everyone for coming to the meeting. And very informative, lots of good information. So we're going to go ahead and close the meeting at 8:03. So thank you all for your time and have a great evening and Happy New Year. Bye.
Congratulations.
Our video's on.
Congratulations, Betsy. Have a good night,
Yeah.
everyone.
Congratulations.
Yes, congratulations.
Yes.